You're watching Good Day Austin on Fox 7.
9:47 on your Monday morning as we talk about CPR, how important it is, what a lifesaver it can be, and the process of learning CPR. We've got Randy Chhabra here from Austin Travis County EMS and Safe Kids Austin. Randy, thank you so much for being here.
Thanks for having us.
It's always important to know CPR. We were just talking about it, but even more so this time of year as kids start to head out to the pool and other activities, you put an emphasis on making sure more and more people learn it.
Sure. You know, nationally, we're only seeing about 32% of the times when cardiac arrests occur that people are actually doing CPR before EMS arrives. And so we really want to get that number up, especially here in the Austin area.
It makes such a difference. You were just talking about it, not only in terms of life and death, and it makes a difference there, but even just in terms of quality of life. If someone is on the scene who can perform CPR in that moment, chances of survival and returning to a normal life are so much greater.
For sure. So they say that every minute that goes by after someone goes into cardiac arrest where CPR is not done, there's a 10% decrease in likelihood of having a positive income. Or you can look at the inverse. For someone who receives CPR within that first 5 minutes, that triples their chance of having a positive outcome.
And yet, do you see a lot of people still not know CPR? I just confess that I do not know CPR. I'm sure you run into that, a lot of people.
Yeah, it's a combination. It's a combination of people are unaware or they haven't been trained, and fear. Sometimes people are scared to act. They're not sure what to do. They're scared of hurting the person who's in the cardiac arrest. So
that's even for people who have had the training in the moment, kind of in the clutch, so to speak, they've got to put that into practice.
It really is. It really, just because you had the training isn't necessarily enough. You have to understand that your actions first are going to have a huge impact on the positive versus negative outcome, but also that you're not going to do anything wrong.
Okay.
So if you see someone who goes into cardiac arrest who needs help, call 911. We have incredible dispatchers that are going to keep you calm. They're going to work you through it, and then start doing chest compressions.
Wow. Okay. So you brought some dummies in to kind of teach us a few things or show us a few things here now.
Absolutely. And so the theory or the concept of CPR is the same regardless of size or age. So it's about squeezing the chest, compressing the heart, and pushing the blood around. But the technique might change. So as a child or an infant, we might only do CPR and use 2 fingers because their heart's a lot smaller.
Okay.
And we want half the depth of their chest, strong and fast. Just squeeze that heart and circulate that blood. On an adult, as they get bigger or toddler, you might use 1 hand.
Okay.
Or you might need to use 2 hands. And again, we want
That's
1.5 inches. And on our mannequin, we have some feedback where we can feel the clicking.
Yeah. We talk about it on the newborn too. I think that you never hear that more than if someone's worried about hurting someone.
Right.
On a newborn baby, how delicate and how gentle they are to really put that compression on there.
They are, but they're also very pliable, right? And so again, you're not going to hurt them, regardless if it's an infant, a newborn, or your spouse or your parent. So we're all very pliable. The worst thing that we can do when someone's in cardiac arrest is do nothing. Right. Because literally, it's the difference between life and death. Yeah. So we really need to make sure that we get on their chest, do good compressions, on call 911.
Okay. And Randy, you're talking about classes. Any resources? Of course, Safe Kids Austin, I'm sure, has some information on there if you want to go there.
Absolutely. Safe Kids Austin is a great resource here in Austin. They can also call us at Austin Travis County EMS. We provide free CPR classes to any organization, churches, businesses, Boy Scouts, Girl Scouts. So we're always here for our community.
And like you said, it's good to do as a group of people with your scout troop or something like that, or in your place of work.
For sure, and we can do it in about 30 minutes.
Wonderful.
The CPR training is not long, it's not hard, and it's great, and you can change the life of someone, maybe even your loved one.
Yeah. So again, not only just know the training, but again, have that confidence to act if you're in that position to make a real difference.
Absolutely. Again, the 2 biggest things is to act and to know what to do, and the second thing is to not be scared. Okay. No, you're not going to hurt them.
Wonderful. All right, Randy, thank you so much. We appreciate it.
Thank you.
We're going to wrap things up.